You know, when someone gets seriously hurt, there's this silent killer that often follows. And it's not always the injury itself that's the biggest, most immediate threat. It's a condition called shock. Honestly, understanding what it is could literally be the difference between life and death. So let's break down what's really happening inside the body when it goes into shock. All right, let me ask you something straight up. When you think about a really bad injury, what do you figure is the most common cause of death? Is it, I don't know, the blood loss? The trauma itself? Just take a second and think about what your gut says. And the answer? It's probably not what you're thinking. For so many cases, the most common cause of death after an injury isn't the injury, it's shock. And no, we're not talking about the shock of surprise or fear. We're talking about a full-blown medical emergency where the body just starts shutting down. Okay, so first things first, let's be super clear here. Medical shock has nothing to do with being surprised. It's a catastrophic failure happening at the cellular level, and it all comes down to one critical process. See, it all boils down to this one really important word, perfusion. Just think of it like your body's own internal Amazon Prime delivery service. It's the system that makes sure oxygen-rich blood gets to every single cell, from your brain all the way down to your toes. It is, quite literally, your body's life support system. So medical shock, which is also called hypoperfusion, is what happens when that delivery service completely fails. The whole cardiovascular system collapses, perfusion grinds to a halt, and your cells start starving for oxygen. And the stakes here are, well, they're incredibly high. We're talking just 4 minutes, maybe 6, before the brain can be damaged for good. The body is literally shutting itself down. So to really wrap our heads around this, let's think of our circulatory system like a triangle. We'll call it the perfusion triangle. It's got 3 absolutely essential sides, and for everything to work right, all 3 have to be holding strong. The logic here is actually pretty simple. For your blood to get where it needs to go, you need all 3 parts of this triangle working in perfect harmony. If even one of those sides gets compromised, the whole system is at risk of collapse. And that collapse, that's shock. All right, so first up, you've got the pump. That's the heart, obviously. It's the engine that generates all the force to move the blood through the system. Then, of course, you need the pipes. These are your blood vessels, the massive network of highways that carry that blood everywhere. And finally, you need enough fluid to actually fill up those pipes, and that's the blood itself. So, pump, pipes, and fluid. When all 3 are working, you're good to go. So what happens when one of those 3 sides of the triangle fails? Well, that's when shock kicks in. Let's dig into how that system actually breaks down, and more importantly, what warning signs you need to look for. Okay, so here's where that simple triangle idea gets real. If the pump, the heart, fails, maybe from a heart attack, it just can't push the blood hard enough. That's what we call cardiogenic shock. If you lose too much fluid, the blood, say from a bad bleed, that's hypovolemic shock. And if the pipes suddenly get way too wide, like from a spinal injury, the normal amount of blood isn't enough to fill them up. That's called neurogenic shock. See? 3 totally different problems, but they all lead to the same catastrophic result. Now, here's the tricky part. Shock can be super sneaky at first, so you have to be a bit of a detective and learn to anticipate it. If you come across someone with any of these things, you've got to immediately think shock. We're talking about massive bleeding, multiple broken bones, a big injury to the chest or stomach, a bad infection, classic signs of a heart attack, or a severe allergic reaction. Any of those, and alarm bells for shock should be ringing. And this is exactly why time is your biggest enemy here. Shock isn't just an on or off thing, it's a downward spiral. In the first stage, compensated shock, the body's actually fighting back. The person might just seem anxious or restless, but then it slides into decompensated shock. Now the body is losing the battle. Their blood pressure starts to drop, their breathing gets fast, and they seem confused. And finally, if nothing is done, you hit irreversible shock. At this point, so many cells have died that sadly nothing can save them. Your entire goal in first aid is to step in way, way before that final stage. Okay, we get it. It's serious. So what do we do about it? This is where that knowledge becomes action. Here's your game plan. Don't worry, it boils down to a really simple 4-step action plan. Number 1, make sure the scene is safe for you, then call for help. Call 911 immediately. Number 2, get the person into the right position, and we'll talk about exactly what that means in a sec. 3, prevent heat loss. People in shock get cold fast, so cover them with a blanket, a jacket, whatever you've got. And 4, reassure them. Keep them as calm as you can. Fear and pain will only make shock worse. All right, that positioning step is super important, and it's not a one-size-fits-all deal. It really depends on the injury. If you don't suspect any spine, head, or leg injuries, lay them flat and you can prop their feet up about a foot. But if they're having trouble breathing or have a chest injury, a half-sitting position is much better. If you think there might be a spinal injury, do not move them an inch. Just keep them flat. And finally, if they're unresponsive or vomiting, roll them onto their side. That's the recovery position to make sure their airways stays open. Okay, so we've covered the to-do list, but listen up, because what you don't do is just as critical, maybe even more so. I need you to really burn these into your brain. These are the absolute do-nots. First, do not give them anything to eat or drink, not even water. They might need surgery, and that's a huge risk. Second, don't move them unless their life is in immediate danger right where they are. Third, never assume they're okay just because they say they are. Remember, shock is deceptive. And finally, please forget everything you've seen in old movies. No smelling salts, no splashing water in their face, no slapping them. All of that is useless and can actually cause more harm. You know, this next part really sums up your role perfectly. As the person giving first aid, your job isn't to fix the shock. You can't. That's what the doctors and paramedics are for. Your job is to hit the pause button. By doing all the right things, you can stop the shock from getting worse, buying them that precious time they need for the pros to take over. So, there you have it, the what, the why, and the how of medical shock. The knowledge is all right here. But the real question, the only one that really matters is, if you are faced with this situation tomorrow, are you actually prepared to act? Because when you're in a race against shock, being ready is everything.